Hi, my name is Emma Elise. I'm a student physical therapist. Today we are going to be listening to your lung sounds. Is that okay with you?
Mm-hmm.
Is it okay if we record for educational purposes?
Yes.
Okay. So I'm going to listen to 4 areas on the front side of your chest. This might be a little cold. So first we're going to start with the aortic area, which is on the right side. First intercostal space. Take a deep breath. Thank you. Now we're going to move to the pulmonary, which is on the left. Tricuspid area. And the last, mitral. Could you move your breast tissue out of the way? Thank you. Take a deep breath. Okay. So now I'm going to have you turn around and put the gun on the other side. We're going to listen to the back. Okay. So we're going to do the same thing. Every time I place the stethoscope on you, you can take a deep breath. We're going to start off with the left upper lobe post-apical segment. Now the right upper lobe post-apical segment. Now we're going to do the right lower upper lobe of the post segment. The left lower upper lobe of the post segment. The left lower lobe post superior segment. Right lower lobe post superior segment. Move down to the right lower lobe lateral segment and the left lower lobe lateral segment. Lastly, I'm going to move this out of the way, left posterior inferior basal segment and right lower posterior inferior basal segment. Okay, and now lastly I'm going to do what's called medial percussion. I'm just going to use my fingers to tap on your back, okay?
Mm-hmm.
We're going to compare both sides. They sound even and equal. Thank you.